Greeting everyone. Beforehand, I would like to thank to all the participants because we as SGD B3 can present our paper entitled Blood Glucose Monitoring During Vacation for Type 2 Diabetes on Insulin Injection Therapy. Let me introduce myself. My name is Yanti Graciella with my last 3-digit team number is 162. And this is our members of SGD B3. In this content of list, here we will discuss the introduction, then there is a literature review of which there are 4 contents, and at the end there is a conclusion and advice. Here I will explain the introduction. Diabetes mellitus is a chronic metabolic disorder characterized by high levels of sugar in the blood over a long period of time, or we can call it hyperglycemia. 90% of diabetes cases are type 2 diabetes, according to the International Diabetes Federation or IDF in 2015. 10% of all Americans had diabetes. Then in 2017, there were 425 million people worldwide suffering from diabetes, and 2 years later, in 2019, there were 463 million people suffering from diabetes. Nowadays, diabetes cannot only be found in elderly people, but can also found in younger people. The large number of undiagnosed cases of diabetes causes delayed treatment. The delayed treatment can cause complications such as heart disease, neuropathy, nephropathy, and retinopathy. At this stage, type 2 diabetes mellitus requires insulin injection to regulate the blood level sugar. Insulin dosage settings can be adjusted individually by paying attention to physical activity, food intake, and also glucose level in the blood. The patient who are in vacation, the amount, type, and schedule of food may be different from usual. Physical activity is definitely different. Inappropriate insulin doses will cause hypoglycemia or hyperglycemia, so monitoring glucose levels such as glucometer is needed. So this is the problem formulation and the purpose. For the purpose is to answer the problem formulation. For the benefit, this paper presents the proper information about the glucose monitoring in type 2 diabetes mellitus patient on insulin therapy. This literature explains about the importance, challenges, strategies, and practical tips of monitoring. We sincerely hope that this literature will give a great insight about the glucose monitoring in type 2 diabetes mellitus and will contribute to the improvement of type 2 diabetes mellitus knowledge.
Allow me to introduce myself. My name is Yohanes with the last 3-digit number 089. Self-monitoring of blood glucose provides information about daily blood glucose swings, such as reading before meals, 1 or 2 hours after meals, and at specified periods under certain settings. According to research, SMBG can improve blood glucose management, reducing morbidity and mortality rates, and lessen long-term healthcare expenses for both acute and chronic issues. Its systematic and comprehensive usage can dramatically reduce HbA1c levels. SMBG also ensures the safety of diabetics by detecting hypoglycemia episodes, particularly in those who use insulin and insulin secretagogues, and prevent hypoglycemia during potentially hazardous activities such as driving or operating heavy machinery. It also detects hypoglycemia and hyperglycemia episode during Ramadan and other fasts, as well as monitoring blood glucose levels in unique circumstances such as pregnancy and severe sickness. In addition, SMBG promotes lifestyle improvements by giving objective feedbacks on medical nutrition treatment and physical exercise. It assists decision making by providing data for developing lifestyle modification programs and medical therapist plan, as well as making adjustment to insulin or oral hypoglycemic agent dosage when combined with steroids.
Hello, my name is Wildan Mahsyar and my last name number is 174. About insulin injection therapy. Insulin is sometimes also needed in type 2 diabetes patients with certain conditions. Insulin can be classified into several types based on its length of action, namely like rapid acting insulin, short acting, intermediate acting, long acting, ultra long acting, and premix. The dose and type of insulin given depends on the patient's need. The route of administration can be subcutaneous, intravenous, and intramuscular, but the most common is subcutaneous. because it relatively easier for patients to do the self-administer. The location can be in stomach, from around center to the sides, outer upper arms, and outer side of the thighs. The good adherence can improve glycemic control, thereby reducing the risk of both acute and chronic complications in diabetes patients and reducing the economical burden.
Hello, my name is Sienny Kuswardi and the last three digits of my student number is 004. Now I'm going to explain the challenges of managing type 2 diabetes during vacation, especially in accordance to the changes of routine. When traveling across different time zones, disruption of routine dosing intervals may be more prominent. Going to the east shortens the intervals between the scheduled dose, and in contrast, traveling west lengthens it. Mealtime will also be affected during this travel, so it's important to monitor for glycemic dysregulation. Of the type 2 diabetes mellitus patients, 36.7% increased their food consumption and 45.3% increased their exercise during their trip. In addition, 10.1% took medication sporadically and only 12.9% checked their SMBG while traveling. This will lead to individuals with type 2 diabetes needing extra precautions to maintain their glucose blood level during vacation. That's all from me. Thank you.
Hello everyone, my name is Putu Nirajanari and the last three digits of my student number are 049. I'm here about to explain the environmental factor. So, when someone goes on vacation, of course there are several different things that are felt in new environment compared to their home environment. This difference can be formed of difference in culture, tradition, environment, climate, weather, etc. So the first one we have hot environment. Being high temperature environment can cause the same energy turnover process as when a person do exercise. This can increase the release of energy through the secretion of sweat as an intermediate heat release to maintain body's physiological temperature. However, long-term exposure can increase the risk of complication in type 2 diabetes mellitus patient with comorbidities, because heat can make a person dehydrated due to excessive fluid loss, and decrease in insulin sensitivity due to disruption of insulin signaling, and an increase in gluconeogenesis that make insulin resistance. Second one, we have cold environment. At low temperature, damage to blood vessels can also occur due to a vasoconstrictive response accompanied by obstruction by blood clots in the circulation. This causes blood flow to be disrupted and can result in an increase in blood pressure, which can increase the risk of cardiovascular complication. But positively, cold conditions make the body maintain a normal physiological temperature by heat production and will induce the oxidation process of triglycerides and glucose to be converted into ATP, and resulting in increased glycemic control by lowering blood glucose levels. The last one, we have air pollution. Air pollution such as cigarette smoke and forest fire smoke can increase the concentration of particulate matter 2.5 and nitrogen dioxide in the air, and if inhaled for a long period of time can increase the risk of complications such as cardiovascular disease, respiratory disease, and even cause some death. That's all from me. The next slide will be presented by my friend. Thank you.
Hello, my name is Dewi Dewi with the last digits of my student number are 46, and I'm going to explain about the accessibility issues of this topic. Treating type 2 diabetes mellitus while on vacation is challenging due to issues such as availability of care medications, language barriers, and varying access to medical services in unfamiliar locations. For the medication availability, access to diabetes treatments like insulin and oral medications can vary by brand and availability. Patients need to plan carefully, ensuring they have enough medication for the entire trip, and consider storage conditions, especially for insulin, which may require refrigeration. And for the language barriers, communicating medical needs and understanding instructions can be difficult in foreign languages. This can hinder obtaining prescriptions, medication instructions, and emergency care for diabetes-related issues. And for the healthcare availability, healthcare services vary widely depending on the destination of the vacation. While developed urban areas may offer comprehensive care, rural or less developed regions may have limited resources or lack familiarity with certain chronic conditions like type 2 diabetes mellitus. Yeah?
My name is Patricia Clarine Simpson with the last three digit number 125. So for the preparation before travel for diabetic patients, pre-travel medical consultation is highly recommended. In this consultation, the doctor will educate their patient on how to monitor their blood glucose levels, adjust their medication doses, as well as prepare for emergencies. It is also important that patients carry a medical ID with them while traveling. Patients will also learn how to adjust their insulin dose according to the time zone changes during their trip. and it is important for them to know the most common possible risk in traveling, which is hypoglycemia, which can often be a result of delayed mealtime or infectious disease. By knowing this risk and knowing how to avoid it, the patient will most likely take precautions in order to not get that complication. Thank you.
Hello, doctor and friends. My name is Patricia Orlyn Jotan, and the last three digits of my student number is 171. And I want to explain about several monitoring techniques for blood glucose. The first one is venous plasma blood sample. So venous blood is taken via venipuncture and processed in a commercial lab with stringent quality controls, resulting in a more reliable findings than the capillary blood glucose testing, assuming the lab satisfy industry requirements. However, this procedure can be unpleasant and has a risk of tissue injury and is not appropriate for a regular testing. Another test is capillary blood glucose test. The glucometer, test strip, and lancet are the tools used in the capillary blood glucose testing. So in order to help medical professionals manage diabetes, modern smart glucometers take very little blood sample and also have a Bluetooth capability to sync data with smartphone apps and can record food, medication, and physical activity. Advantages for these tools include a little blood sample, a variety of testing sites, a shorter testing time, a clear display on a glucometer, and less pain than the venipuncture. The disadvantages include the expensive cost of test strip and accessory, short expiry dates, a susceptibility to variables such as temperature and humidity. A patient's clinical condition may also have an impact on the accuracy of the test result. So another monitoring technique is called continuous glucose monitoring, or CGM. CGM entails placing a water-resistant disposable sensor on the back of the arm or belly, which can stay on the patient from 3 to 14 days depending on the device. The sensor can be scanned with a reader displayed to the current interstitial fluid glucose level, as well as the trends from the past 8 hours, and CGM device can also store up to 90 days of glucose data. A smartphone app also allows the data to be shared with family members and caregivers. These devices can also deliver alert, message, or alarms, including during hypoglycemic episodes. Certain CGM can be used in conjunction with insulin delivery system and have the ability to halt insulin administration in the event of on a predicted or actual drop in blood sugar. Modern CGMs do not need this calibration, but the previous one did require twice daily finger prick examination. For these tools, the advantages is research indicates that CGM is more affordable than self-monitoring blood glucose for patients with type 1 diabetes and type 2 diabetes who require extensive insulin therapy. Interstitial glucose can be monitored up to once every 5 minutes, which makes it possible to monitor hypoglycemia while you asleep. One of the advantages of the CGM is may not always accurately detect rapidly fluctuating blood glucose level, since glucose appear in the blood before in the interstitial fluid. The exorbitant annual cost of the sensor and equipment may also provide a barrier for clients from economically disadvantaged backgrounds and regions where insurance or government funding is not available for healthcare. Another thing to care about in monitoring techniques is the glycemic care. Capillary blood glucose testing is the recommended testing method for clients with diabetes mellitus in non-critical care settings to ensure optimal glycemic control. For clients who are able to eat, blood glucose testing is advised prior to meals and before bedtime. Testing should be done every 4 to 6 hours for clients who are nil by ORIS or receiving enteral feedings. An initial blood glucose check will help all hospitalized patients regardless of diabetes mellitus history. And the best way to control hypoglycemia in a hospital context is to use glucose management procedure along with nurse-initiated treatment controls. So when do we do this? Blood glucose needs to be measured in several conditions. The first one is measurement of the blood glucose should be made anytime a diabetic patient appears ill. The second one is in order to make sure the diabetic patient won't fall ill during or after general anesthesia, it should be measured before surgery. Measure on a frequent basis until the patient eating and drinking habits are normal and his or her blood glucose level is steady. The third one is more frequent testing is required in people with recently diagnosed diabetes until blood glucose is stabilized. I think that's all for me. The next will be explained by my friend. Thank you.
Hello, my name is Komang Surya Mahottama with the last 3 digits of the number 221. With so many holiday foods and snacks, it can be difficult to control your blood sugar levels during the holiday. People who are concerned about controlling their blood sugar levels can find a balance between enjoying the holidays and staying healthy through conscious nutrition strategies. Here are a few practical tips for blood glucose monitoring during vacation. Mindful carbohydrate intake, fiber-rich choices, glycemic index awareness, hydration habits, portion control practice, healthy snacking, probiotic-rich choices, limit sugary treat, balance macronutrients in each meal, real food labels. Thank you.
Good morning, doctor. Let me introduce myself. My name is Manko Jonathan Raya with Rila student ID number 182. Now I'm going to present the physical activity in blood glucose monitoring treatment in type 2 diabetes mellitus. So, clinical practice guidelines promote physical activity as a representative and therapeutic intervention for diabetic treatment. Many studies provide support to this recommendation. However, because they run the danger of causing a blood glucose sugar derailment, patients with type 1 diabetes and type 2 diabetes find it difficult to engage in physical exercise. In order to prevent hypoglycemia during exercising, patients need to adjust their insulin dosage and carbohydrate consumption. Within this context, CGM devices have demonstrated their efficacy in promptly identifying variations in blood sugar levels during physical activity. And by reducing hypoglycemia and prolonging the time in range, automated insulin delivery systems may improve total glycemia. Since the functioning of each AID system varies slightly, exercise planning must take a personalized approach. Strategies for planned exercise will be shown below, such as combination strategy, establish exercise goal, insulin bolus at mealtime, or turn off automated mode and switch to manual mode, or examine IOB and decide on an exercise strategy. And for strategies for unplanned or spontaneous exercise, we could consume carbohydrates before or during physical activity. Insulin should be stopped in the beginning, and don't alter the standard AID settings when exercising. And that's all from me. Thank you.
Thank you for the opportunity. My name is Putu Chandrika Rahma Dewi with the last 3 digits students number 071. So here I would like to present about the emergency preparedness. An emergency at some point in time may be approaching, so it requires good preparations. First thing to prepare is understanding how to get help in an emergency. Patients must learn sufficient language proficiency to make help requests and obtain lists of healthcare facilities. Consequently, the diabetic patients must understand the preparations of items in emergency. The first one is identification item, and it can be diabetic ribbon, bracelet, and necklace to inform medical staff of patients' diabetes conditions. Then, diabetic patients are advised to monitor their blood supply and minimize leakage. For example, pack a lot of supplies in carry-on luggage. Finally, it is recommended that patients with diabetes present the physician notes and medicines in order to pursue airport security staff. Apart from these preparations, patients must be aware of emergency conditions such as the hypoglycemia and hyperglycemia. To prevent hypoglycemia, patients must include snacks that contain both simple and complex carbohydrate. Then to prevent hyperglycemia or diabetic ketoacidosis is to encouraging adequate hydrations, and for the insulin dose reduction for diabetic ketoacidosis prophylaxis must only be made on the individual basis. Okay, that's all for me. For the next presenter, time is yours.
Greetings, doctor and everyone. My name is Bagus Tresna Indra Putra Pramana with the last 3-digit number 104. And now I will explain about the conclusion and also advice for this paper. So, self-monitoring of blood glucose or SMBG is crucial for managing diabetes as it provides essential data for improving blood glucose control, preventing hypoglycemia, and guiding lifestyle and treatment adjustments, thereby reducing long-term health complications and also costs. Adherence to insulin therapy is crucial for effectively managing diabetes and preventing complications with various types of insulin administered subcutaneously based on individual patient needs and also action profiles. type 2 diabetes mellitus patients face challenges such as irregular meal times, dietary changes, and also altered physical activity and disrupted medication routines during travel, necessitating careful monitoring and also management of blood glucose levels. Clinical practice guidelines recommend physical activity for diabetes management, but patients with type 1 diabetes and type 2 diabetes face challenges in preventing blood sugar derailment during exercise. To avoid hypoglycemia, patients must adjust insulin dosage and also carbohydrate intake based on current blood glucose levels, with CGM devices proving effective in monitoring these levels during the activity. Automated insulin delivery or AID systems can improve overall glycemia by reducing hypoglycemia and increasing time in range through their accuracy is tested during exercise. And for the advice for this paper, further study on blood glucose monitoring, especially on type 2 diabetes patients during vacations, can be done to improve and optimize insulin dosing and monitoring protocols to ensure safe and effective management during vacation. This can be achieved by investigating further on the impact of travel-related factors, such as changes in diet, activity levels, and also time zones. And that is all the presentation from SGD B3. Thank you for your attention and thank you for listening.